So this is the informed consent between Jasmine and Mike. Mike is the participant, and Jasmine is reading off the informed consent. Go ahead.
Mike, before we do any of these tests, I kind of want to explain them. So the graded exercise test is performed on a cycloergometer or a motor-driven treadmill. The workload is increased every few minutes and until exhaustion or until other symptoms dictate whether we can terminate the test or not. You can stop the test whenever you feel uncomfortable or tired. The underwater weighing procedure involves being completely submerged in a tank or tub after fully exhaling the air from your lungs. You'll be submerged for 3 to 5 seconds while we measure your underwater weight. This test provides an accurate assessment of your body composition. For the muscle fitness testing, you'll lift weights for a number of repetitions using barbells or exercise machines. These tests assess the strength and endurance of the major muscle groups in the body. For evaluation of flexibility, you perform a number of tests. During these tests, we measure the range of motion of your joints. For a balance test, we will be measuring the amount of time you can maintain certain stances or the distance you are able to reach without losing balance. The risks and discomforts for each test, certain changes may occur. These changes include abnormal blood pressure responses, fainting, irregularities in heartbeat, and heart attack. Every effort is made to minimize these occurrences, and emergency equipment and trained personnel are available to deal with these situations if they do occur. Are you able to perform these?
Yes.
Okay, that's it. So,
Yeah.
has your doctor ever said that you have a heart condition or high blood pressure?
No.
Do you feel pain in your chest at rest during your daily activities of living or when you do physical activity? Do you lose balance because of dizziness or have you lost consciousness in the last 12 months?
So I was taking, you just have to probably read this and get my stamp.
Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No.
Are you currently taking prescribed medications for a chronic medical condition?
No.
Do you currently have or have had within the past 12 months a bone, joint, or soft tissue problem that could be made worse by becoming more physically active, like muscle?
Yes.
Now we have been.
And which one?
Elbow. Right elbow. Elbow ligament. Right
Has your doctor ever said that you should only do medically supervised physical activity?
No.
Well, maybe
That's it.
Perfect. So,
Alright, so we're doing a blood pressure lab today. This is a stethoscope. This is a sphygmomanometer. That's how you say it correctly. This is a properly fitted cuff to Michael here, size large, not a kid size. First, we're going to clean off the stethoscope with alcohol wipe. Put this in my ear so I can hear it. We're also going to put this right at the midpoint of his electron processing equipment process. So it's going to sit right in the middle of his bicep belly. And we're going to take this, measure exactly on the brachial artery, right there. Now, I'm going to push it here and keep it here while Jesse pumps it up. So he's going to pump it up to about 180 until it started about there, and then we're going to slowly release it. Now I'm going to start it right there, where it's at 126 for his systolic blood pressure. And then it stops about 88 to release it fully. The gauge is always should be about eye level, so it is faced towards me so I can see it this time. Slowly release the pressure, listen to the blood flow. Phase 4 is systolic blood pressure when I start hearing it at 126, and then release it to phase 5, which is at 88 down here. That's how you measure resting blood pressure.
Let me get to 60 first.
Okay, so this is the same blood pressure test that we just did before, but this is going to be on an exercise test on a bike, cycloergometer. Again, we had the stethoscope cleaned off, sphygmomanometer. Hold it up high. I'm going to put this on the brachial artery right here. Jesse's going to slowly increase the pressure. I'm going to start start it when I hear his systolic pressure, which is at 166. His diastolic ends at 88.